Welcome to the deep dive. Today we're looking into pneumonia.
Hmm.
Now, you might think it's not a huge modern health challenge here in the US, maybe something from the past.
Right. You sort of expect it to be less of a concern now.
Exactly. But our sources, we've got info from the US Centers for Disease Control and Prevention, the CDC, and also an article called Understanding Pneumonia, Causes and Treatment. They actually paint a different picture.
Yeah, quite different.
So our mission today is really to pull out the key facts, the numbers, that show just how common pneumonia still is.
It's kind of surprising when you dig in. With all the medical progress, you'd think something like pneumonia wouldn't have such a big footprint anymore.
But the data, well, it tells us otherwise.
It certainly does.
Okay, so let's unpack this. The CDC data and the article backs this up, shows about 41,000 people in the U.S. die from pneumonia every year.
41,000.
Yeah, 41,000. Well, it's a pretty sobering figure, isn't it?
It really is. When you think about how far we've come with treating infections, that number, it really highlights that pneumonia is still very serious.
A major threat for many.
Definitely. It's clearly not just a minor cold for a lot of people.
And it's not just about the fatalities, right? The CDC also reports over 1.4 million emergency room visits annually because of pneumonia.
Wow, 1.4 million.
Over 1.4 million trips to the ER. What does that number tell you?
Well, that huge figure, it points to a massive burden on the healthcare system, for one.
Right.
And it also suggests that for many individuals, pneumonia gets bad enough that it needs urgent medical care. It's not always something you can just manage at home or, with a quick doctor's visit.
So it often escalates.
It seems that way.
Okay, maybe for listeners who aren't totally familiar, let's just quickly define what pneumonia actually is.
Sure. So basically, pneumonia is an infection. It inflames the air sacs in your lungs, either one or both. And those sacs can fill up with fluid or pus. That's what causes the symptoms we know. The cough, fever, chills, difficulty breathing.
Got it.
Now, our article does mention that it causes bacteria, viruses, things like that, and the usual treatments. But like you said, we're really focusing today on just how widespread this problem still is, the scale of it.
Right. We're not getting into the specific bugs or treatments here. What's really hitting me is just the sheer volume of serious cases. Even with modern medicine, it makes you wonder why it's still so prevalent.
Well, what's interesting, and the article touches on this, is that while pneumonia might be less deadly overall than it used to be.
Which is good, obviously, a testament to medical science.
Absolutely. But these numbers, we're talking about 41,000 deaths, 1.4 million ER visits. They still show an illness that has a really significant hold on public health in the U.S.
It really does. And it makes you think, who is it affecting most? Are there certain groups, maybe older adults or people with other health issues, who are more vulnerable?
That's a key question.
Because the sheer volume suggests it's not just a small niche problem.
Exactly. And if you connect that to the bigger picture, it sort of begs the question, doesn't it? What are the underlying factors keeping these numbers so high?
Like access to care?
Maybe. Or the prevalence of risk factors like smoking or chronic conditions. Or perhaps something else entirely we haven't considered. These stats really bring those questions up.
Yeah, they definitely do. Okay, so to sort of bring this together, what we've seen from the CDC in the article is pretty clear. Pneumonia is still a major public health issue in the United States.
No doubt about it.
Those numbers, roughly 41,000 deaths a year, over 1.4 million ER visits, they really underscore that this isn't a disease we can just ignore.
Absolutely not. And maybe that leads to a final thought for you listening. Given these really significant figures, even with all the medical advances we have, what do you think are some of the key factors still driving pneumonia's impact in the U.S. today? It's definitely something worth thinking about.